What is Original Medicare? Original Medicare is the health insurance that becomes available to you or your friends or family when they turn age 65. So this is a straight age 65 qualification. It has nothing to do with your quote unquote normal retirement age. So you may be thinking, well, my normal retirement age is 66 or 66 and 2 months. I don't need to think about Medicare until I'm at my normal retirement age, but that's not true. Normal retirement age pertains to when you can collect your full Social Security income benefits. It does not have anything to do with Medicare benefits. So at age 65, you have a decision to make. Do I enroll in Medicare like all of the literature I'm receiving says I have to do? Or do I have a valid reason to defer my Medicare until later, until I retire or until I decide to come off my current coverage? And those are the things that we help you figure out. In addition, you might be eligible for Medicare if you're under 65 and collecting Social Security disability income, or if you have any kidney issues like end-stage renal disease, kidney failure, kidney dialysis, or kidney transplant. So talking about the base Medicare program through the federal government, there's Medicare Part A, which is available to most people at no cost. So as long as either you or your spouse has paid Medicare taxes for a minimum of 10 years throughout your lifetime, you are able to collect Medicare Part A at no additional cost. That's what your taxes pay for. Part A is your inpatient hospital coverage. So I always say, think of A for admission into the hospital. If you're admitted in the hospital, it's going to fall under Medicare Part A. And it does cover some other things as well, but primarily it's for inpatient hospital stays. Now, Medicare Part B is your outpatient coverage. So it's called Part B medical, but I would like you to remember A is inpatient and B is outpatient. So everything that you're not admitted to the hospital for example, doctors and specialists, labs, x-rays, MRIs, surgeries, chemotherapy, even things that you go to the hospital for, but you're not admitted for example, emergency room treatment, or if you're in the hospital being observed for a couple days, hospital observation, that is all considered outpatient coverage, and it falls under Medicare Part B. Now, Medicare Part B does have a cost, and the cost is going to be dependent on your income. Now, the base Medicare Part B premium for 2021 is $148.50 per month. So as you can see by looking at this graph, if your income, if you file your tax return as an individual or a single and your income is up to $88,000 per year, or if you file your tax return as a joint or a household and your income is up to $176,000 a year, you will pay the base Medicare premium of $148.50 per month, and that's per month and that's per person. That's a per person premium. If you're collecting Social Security income, this is going to come directly out of your Social Security income. If not, the Social Security Administration will bill you for that amount of money. But as you see, if your income is higher, and you see the different income brackets here, you will pay a higher Medicare premium. Okay, so Medicare A and B through the federal government is great baseline coverage. It does not cover everything, and there are certain things that are excluded from Medicare. For example, dental care, vision, except for medical conditions like cataracts, glaucoma, diabetic eye checkups. Hearing aids are not covered by Medicare. And things like long-term care. I don't know if you've ever heard of long-term care. What I'm talking about is like home health aides, assisted living, nursing homes. They're typically not covered by Medicare if they're for everyday needs. So if you get old and you need help getting around and getting dressed and getting a shower, Medicare does not pay for those type things. What it will pay for is rehab services. So physical, occupational, or speech therapy. There's limited services for skilled nursing rehab after some kind of hospital visit. Maybe you've had a stroke and you need to go to a rehab center afterward to get better before they release you to home. Medicare does pay for some rehab. Certain restrictions apply, but they do not pay for everyday help with personal needs like dressing and bathing, preparing your meals, getting to and from doctor visits, things like that. The other three things I think are pretty self-explanatory that Medicare doesn't pay for. However, New for 2021, Medicare just started offering services for acupuncture and paying for that. Now, it does have some restrictions. It has to be for chronic low back pain, and they only cover so many visits. But in my opinion, that's a step in the right direction, because in the past, we've never seen Medicare covering holistic type cares. And this is the first step in the new direction. So just so you know, there are separate policies available to cover some of these things. There's long-term care insurance, there's dental, vision, hearing policies, and some of the Medicare Advantage plans, and you'll see them advertised on TV, may also include extra benefits for dental, vision, hearing aids, and things along those lines as well. So definitely ask about that if that's a concern for you. So what you see on your screen here is what the expenses are if you had Medicare A and B only. Now, we would never suggest that you only do Medicare A and B. We would always suggest that you add some kind of secondary insurance to it. So this likely will not be your out of pocket, but it's important to know how Medicare treats it. So if Medicare Part A, again, is your inpatient hospital coverage. If you go into a hospital, you will pay $1,484 per hospital stay. And if you're in there for an extended period of time, over 60 or 90 days, you'll start paying a daily copay of $371 to $742 per day in the hospital over 60 days. Now, under the Part B, this is the outpatient stuff. This is where most of your services are going to fall. You have a pretty reasonable deductible. $203 per calendar year is the deductible. And for most of you, this is probably better than your current health insurance plan. But after the deductible is satisfied, there is a 20% coinsurance on your expenses thereafter. And where the risk really lies in Medicare is the fact that there is no maximum out of pocket on that 20% cost share. So you will pay 20% of the $100 bill, but you'll also pay 20% of the $100,000 bill. So that's why it's important to have secondary insurance to put a cap on what your risk is. In addition to that, believe it or not, doctors can actually accept Medicare as your insurance, and about 98% of doctors nationwide accept Medicare. So they can accept Medicare as your insurance, but they can charge more than the Medicare allowable rate for their services. In fact, they can charge up to 15% over and above the Medicare allowable rate. And there's no cap on this. So 15% of whatever the Medicare rate is, they can add to that. And of course, Medicare is not going to pay for it because it's above their cap. So this would go back to you if you didn't have secondary insurance that covered excess charges.